Are you going for a tooth extraction? It's normal to feel a little nervous. Don't worry, preparing well makes a big difference. Tell your dentist about all the medicines you take. This includes pills, syrups, or any herbal remedies. Let them know if you are allergic to any medicines. Before you go for the extraction, eat a good meal. It's best to have this meal about 1.5 hours before your appointment. Also, take your regular medicines about 1.5 hours before. It's important not to drive after the extraction. Ask a family member or friend to take you home. Once you're in the dentist's chair, relax. Your dentist will take care of everything. If you feel anxious, let them know. They can help you feel more relaxed. Remember, good preparation makes the whole process smoother. So, you've just had your tooth taken out. What should you do now? The first hour is very important. Your dentist will put a cotton pad on the extraction site. This helps to stop the bleeding. Bite down on this cotton pad gently but firmly. Keep biting for about an hour. This will help a blood clot to form, which is crucial for healing. After an hour, you can gently remove the cotton pad. Don't throw it away immediately. Check if it's soaked with blood. A little blood is normal, but if the bleeding seems excessive, put a fresh, new autoclaved piece of cotton and bite down again slowly for another 30 minutes. Now, resist the urge to touch the extraction site with your tongue or fingers. You might be curious to see how it looks, but it's important to avoid touching it. This can disturb the healing process and even introduce infection. It's normal for some bleeding droplets to continue for a few hours after the extraction. Don't worry, it will stop on its own. To help control the bleeding, you can do a simple thing. Take a clean piece of gauze or a clean handkerchief and fold it. Place this folded gauze over the area where the tooth was extracted. Bite down firmly on this gauze for about 30 minutes. You'll likely have some swelling as well, particularly in the first 24 hours. This is a normal part of the healing process. To reduce swelling, apply an ice pack to your cheek near the extraction area. Keep the ice pack on for 15 minutes, then remove it for 15 minutes. You can repeat this on and off for a few hours. Remember, even with bleeding and swelling, don't panic. These are normal after effects of an extraction. Follow the instructions given and you'll be just fine. If you're ever unsure about anything, don't hesitate to contact your dentist's office for advice. Section 4. Keeping your mouth clean after extraction. After your tooth extraction, keeping your mouth clean is super important. But you can't brush or rinse your mouth for the first 24 hours. This is because it can disturb the healing process. After the first 24 hours, you can start rinsing your mouth very gently with warm salt water. To make salt water, mix a teaspoon of salt in a glass of lukewarm water. Rinse your mouth with this solution 3 to 4 times a day, especially after meals. This will help to keep the extraction site clean and prevent infection. When you brush your teeth, be extra gentle around the extraction site. Remember, a clean mouth heals faster. While you might be tempted to brush vigorously or use mouthwash, stick to gentle saltwater rinses for the first few days. As you heal, you can gradually return to your normal oral hygiene routine. Section 5. Eating the right foods for healing. What you eat plays a big role in how quickly you recover after a tooth extraction. For the first 24 hours, stick to soft foods that are easy to eat and don't require much chewing. Think soups, yogurt, mashed potatoes, and smoothies. Make sure the food is lukewarm or cold, not hot. Avoid anything spicy, acidic, or crunchy for at least a week. These can irritate the extraction site and delay healing. Instead, focus on nutritious foods that will help your body recover. Good options include scrambled eggs, soft fruits like bananas, and well-cooked vegetables. Remember, eating the right foods is like giving your body the building blocks it needs to heal. A healthy diet will not only speed up your recovery, but also make you feel better overall. As the extraction site heals and you feel more comfortable, you can gradually reintroduce solid foods into your diet. Section 6. Do's and don'ts for quick recovery. After your tooth extraction, There are a few important things to keep in mind to ensure a smooth and quick recovery. First, let's talk about what you should avoid. Don't smoke or consume alcohol for at least 48 hours after the extraction. These substances can interfere with healing and increase the risk of complications. Avoid spitting or rinsing your mouth vigorously for the first 24 hours. This can dislodge the blood clot that's forming and lead to bleeding. Don't use a straw to drink. The suction can also dislodge the blood clot. Steer clear of strenuous activities for a few days. This includes exercise, heavy lifting, and anything that might put stress on your jaw. Now here are some things you should do. Take your prescribed pain medication as directed by your dentist. This will help manage any discomfort you might experience. Get plenty of rest, especially in the first 24 hours. This will allow your body to focus on healing. Stay hydrated by drinking plenty of fluids. Water is best, but you can also have clear broth and juice. If you notice excessive bleeding, swelling, or pain that doesn't subside with medication, contact your dentist immediately. Section 7. When to call your dentist. While most tooth extractions heal without any problems, it's important to know when to call your dentist for advice. If you experience any of the following, don't hesitate to reach out to your dentist. Uncontrolled bleeding. Some bleeding is normal after an extraction, but if it's heavy or doesn't stop after applying pressure with gauze, contact your dentist. Severe pain. While some discomfort is expected, if you experience severe pain that isn't managed by your prescribed pain medication, call your dentist. Signs of infection. Look out for redness, swelling, or pus discharge around the extraction site. You may also experience a fever, nausea, or vomiting. If you experience nausea or vomiting after the extraction, especially if it persists, contact your dentist. Remember, it's always better to err on the side of caution and contact your dentist if you have any concerns. They are there to support you throughout your recovery and ensure everything goes smoothly.